Welcome to the Disablement Services Centre at Withington Hospital in South Manchester. This DVD has been made to help you with the background details of your first or primary appointment at the DSC. It lasts 10 minutes and takes you through all the relevant departments from arrival to departure. If at the end of the DVD you still have questions, please read the booklet that you were given whilst in hospital. If you still have questions after reading that, and they cannot wait until you come, then please phone us on 0161 611 3784. However, we cannot answer any questions about whether you are suitable for an artificial leg. Please make note of any questions before you come, so that you remember to ask them all. The Manchester Disablement Services Centre is in Withington, South Manchester. It has been in its present location since 1973. It is the largest single-limb centre in Europe. It sees about 350 new amputee patients a year. The first appointment, a primary appointment, is what you will be coming for, usually about 4 to 6 weeks after your amputation. The DSC team is made up of doctors, nurses, physiotherapists, occupational therapists, prosthetists, and the technicians who make the artificial limbs. There is also a team of administrative staff who make sure the whole operation runs smoothly. The limb office staff answer queries about appointments and rebookings. If you can, please come to the centre with your own transport. However, if you do not have a relative or friend who can drive you, we can arrange ambulance transport. We can provide a place for an escort to attend with you at this primary appointment, but for any further appointments at the centre, an escort place is not available. We have wheelchairs for you to use while you are at the DSC. When you arrive, you will be greeted by the reception staff, who sit behind the desk as you come through the sliding doors. They will be aware of your appointment. They will confirm the time. Although the ambulance service will make every effort to get you to the DSC on time, sometimes people arrive late for primary appointments. If this happens to you, don't worry, we will still see you. The reception staff will then ask you to wait in our reception area. The reception area has enough chairs and tables for even the busiest time of day. There is also a play area for children, but they need to be supervised. There is a WRVS cafe staffed by volunteers, so please bring some money with you in case you want to buy something. Very occasionally the cafe is not open, so it's a good idea to bring a snack just in case. This is especially important if you are diabetic. We have wheelchair accessible toilets at the DSC. If you need help using these facilities, please ask the reception staff. The primary appointment will last about 2 hours. During this time, you will see several different healthcare professionals. We are here to help you, so please feel free to ask us for help with any difficulty you are having. It is usually the clinic coordinator who will collect you from the reception area. They will confirm some basic information, such as your address, current living situation, and past medical history. They may also weigh you. You can help us a great deal by bringing an up-to-date list of the drugs that you are taking. You will be initially seen by our clinic nurse. The nursing staff have many years of experience with wounds from amputations. If you still have a wound that needs dressing, they will, with your consent, remove the dressing and may take a photo of it. The doctor will need to see this as part of his or her assessment. At all times, we will respect your dignity and privacy. The photos are used to see how your wound is changing. Having an amputation changes our lives significantly and is something we need to adjust to in many different ways, both practically and emotionally. Everyone will react differently, and adapting constructively can be very challenging. Having a confidential space to share our feelings and thoughts can help, and the counselling service at the DSC provides an opportunity to work through any difficulties we are having. The service can also help with the management of pain and is available for family members as well.
So, up above your head.
Ideally, you will have had treatment sessions with a local NHS physiotherapist between your discharge and coming to the DSC. It is very important to do the stretches and exercises that you have been shown. These will help keep your hips and knees moving in all the right ways and keep your strength up.
Hands on shoulders.
The physiotherapists at the DSC will check your muscle strength, balance, and the amount of movement you have.
And squeeze my fingers as hard as you can. And don't let me move your hands around, okay? Lovely. Hands on chest. Now keep your hips there and twist your spine so you're looking out the window. So twist, lovely. Opposite direction. Okay, and now slump down forwards for me. Okay, and now arch your back in the opposite
All these
direction.
healthcare professionals will fill in
Lovely.
paperwork so that when the doctor sees you, he or she has an overview of what your current health status is. Our aim throughout all of this is to help you achieve the best possible quality of life.
Lovely. Nice to meet you.
Oh.
Hello.
Hello there. Have a seat. Have a seat. Right, Mr. Hartley. I'm Dr. Kulkarni. I'm one of the consultants here.
Oh.
You've been referred.
The doctor will take further details and do a thorough clinical examination. The doctor also needs to consider all the factors that have brought you to the DSC, whether your heart and breathing are strong enough for using an artificial leg, which will take more energy than you used before. The doctor will discuss with you issues regarding looking after your residual limb and your remaining leg. They will also talk with you about artificial limbs and whether you are clinically suitable, and also whether you wish to proceed or not. Sometimes patients do not want an artificial leg, and we certainly do not force them to do something they don't want to do. If you are not sure, or the doctor is not sure, that you are going to benefit from having an artificial leg, we can call you back at a later date, usually after a month, to re-evaluate your situation. If it is decided that having an artificial limb is going to improve your quality of life, the prosthetist who is going to make your leg will come to see you, just to introduce themselves.
Oh,
Hi John, my name's Amy.
hi Emma.
Nice to meet you.
And you.
I'm one of the prosthetists here within the DSC.
Right.
So I'll be the prosthetist that will make your first prostheses. Okay?
Right.
And once your wound's healed, we will do that, and that will happen in a week or so.
Right.
Okay? Just as an example, this is a basic first training prostheses.
Yeah.
The prosthetic foot here, the ankle, the pylon, and then onto the socket. Okay, the first part is the peel-out liner, which is the inner.
Is that the bit that you make a cast of?
Yes, precisely. Okay, and then that slots in like that, and then the whole thing suspends on your knee with the sleeve, like that.
Right, yeah.
Okay, so that's what the basic prosthesis looks like.
Lovely.
And
In most cases, you will be issued with a stump sock. They will call you back for another appointment, usually a week or two later. This measurement appointment is known as a casting appointment. The prosthetist will take a series of measures of your legs, your height and your weight. They will then decide, with the doctor, what kind of artificial leg is best for you. It will then be made by our skilled technicians in our workshop.
Use it as an eggshell.
During this time, you will continue to have physiotherapy appointments at either the DSC or a physiotherapy department closer to where you live. The whole process of a primary appointment should take 2 or 3 hours, but we ask you to be patient with us, since sometimes we are very busy. However, your comfort and well-being are very important to us, so please don't be afraid to ask if you need help at any stage. After you have seen everyone, please tell the reception staff that you are ready to go home. If you came with family or friends, then you are able to leave straight away. If you came in an ambulance, we will tell ambulance control that you are ready to go home. There may be a wait before they can collect you. Please try to be patient. The ambulances have to pick up from other hospitals within the area, and this can cause delays.